We're here today with Tim Davies, Managing Director and Qualified Solicitor at Compass Continuing Healthcare.
Hello. The purpose of today's video and all of the videos that we will be looking to upload to our website are in an effort to be able to explain the issues surrounding continuing healthcare funding and hopefully provide some useful information that will be of assistance to people navigating their way through this complicated process.
So what is continuing healthcare funding?
Continuing healthcare funding is a form of funding provided by the NHS to pay for the cost of an individual's care in full where it is established that their need for care is primarily a health need. Now, it's very important to note that first and foremost, continuing healthcare funding is not in any way, shape or form means tested. It's utterly irrelevant whether the individual has a house or money in the bank. It's not means tested. It's primarily, do they have a health need? If so, they are entitled to the funding. Secondly, it's not relevant where the individual is located. People can be incorrectly informed that they're not entitled to the funding if they're still at home or if they're living in a residential home. The setting of the individual is not relevant. It's entirely whether their needs are health needs. Now, the process for determining what is a health need and whether somebody is entitled to continuing healthcare funding is via a series of assessments conducted by the NHS and in certain circumstances social workers. The individual will be assessed across a broad range of issues. It's not the case that if you have any particular health condition, for example Alzheimer's, dementia, Parkinson's, you're automatically entitled to funding, but rather how your health needs present and whether overall they are deemed sufficiently complex, intense and unpredictable in their nature. The flip side of the coin, therefore, is that you don't have to have been diagnosed as having a particular condition to be eligible for the funding either. It can be the case that you have a number of different complexities to do with your health, no formal diagnosis of any particular condition, and are still entitled to the funding. The assessment process itself looks at a broad range of domains which covers areas totaling 12 and including factors such as behaviour, cognition, psychological and emotional needs, communication, mobility, an individual's nutrition, any problems they have with continence or their skin, any issues with medication and pain, and any issues with altered states of consciousness. So, for example, that would include problems with having had strokes or seizures or hypo or hyperglycemic episodes. There is a final domain which looks at other needs which haven't been encompassed in those descriptors. So it's a very comprehensive assessment of the individual across every facet of what they could be troubled by. Their needs are then scored from no needs through to low, moderate, high, and in certain domains beyond that further still with a severe or a priority option. Once the 12 needs have been determined as to what level of need that they are, the assessment team then take a step back, look at the overall picture and say that in light of those, what information has been gathered in this assessment thus far, are the needs sufficiently complex, intense and unpredictable in their nature to be considered primarily health needs. If that's the case, then the individual will be entitled to continuing healthcare funding to pay for the cost of their care in full.
What issues can there be with securing continuing healthcare funding?
The problem is that across the country, the national framework for continuing healthcare funding can unfortunately be interpreted in different ways with a different understanding by different NHS trusts or CCGs, which are the abbreviation for clinical commissioning groups, who are responsible for the assessment and implementation of continuing healthcare funding. Various studies have shown that the number of individuals within different CCG areas can vary as to who's receiving funding and who isn't. Clearly, it would be unfair for someone who would receive funding in a certain NHS domain to not receive it because they live down the road or in a different part of the country. That is simply not fair. There should not be a postcode lottery where different trusts with different budgetary availability are awarding more or less funding to individuals. It should be a fair process according to the national framework where an individual's needs are assessed, and if they meet the criteria, they're entitled to the funding. The second issue is that the assessment process itself is ultimately a subjective one, because you are asking an assessor to give their view of what a particular individual's needs are and where it sits within the domains and the descriptors as to a particular level of need. That, in essence, is therefore one person's opinion, or in the case of a multidisciplinary assessment, a minimum of two people's opinions, which of course could vary from area to area. What we need to ensure is that an individual's needs are fairly assessed, they are not downgraded, they are not underplayed, and that if they meet the criteria for funding, they are provided with it. Unfortunately, that is not always the case, and it can be necessary to have to appeal outcomes and for decisions to be overturned. Various studies have shown that there is a high proportion of individuals who should have received the funding who may not have even been informed it exists, and no assessment has ever been undertaken, through to the process of assessment being incorrectly undertaken. But leading in from that, of course, the final outcome is that people that should have been receiving the funding are incorrectly denied it, and that can be evidenced by the number of cases that are then overturned ultimately at appeal, and the funding is then awarded.
Why should I approach Compass CHC to assist me in this area?
Compass CHC are a company that specialise exclusively in assisting people with issues surrounding continuing healthcare funding. We are unique in that we operate a system whereby we employ both qualified non-practicing lawyers and expert clinicians who are able to look at matters from a medical perspective. So in the first instance, we're able to gather the relevant independent medical evidence and care records where available. Our medical team, which consists of both nurses, pharmacists and tissue viability nurses, are able to peruse those records and pull the relevant information out that supports an individual's entitlement to the funding. Having gathered that medical evidence, our team of non-practicing lawyers are able to cross-refer the evidence from an analytical sort of legal perspective and cross-refer and draft representations and arguments as to why an individual's entitled to the funding and how a particular criteria is satisfied, cross-referring to the evidence itself. Additionally, the company are able to provide expert advocates to attend assessments alongside our clients and, where necessary, attend appeal hearings both at local level and ultimately, if necessary, at NHS England level. As such, we're able to offer a package from start to finish to assist our clients through every step of the process, to afford them the best opportunity of receiving the funding where they meet the eligibility criteria. What I would say is that this is a series of videos where we're hopefully providing you useful information regarding continuing healthcare funding. If we can be of assistance, if you have any queries at all whatsoever and you wish to discuss matters further, you should not hesitate to contact an expert member of our team. The details of the company are of course behind us. The website address is www.continuing-healthcare.co.uk and our telephone number is 0121 227 8940. Thank you.